Good afternoon. We are the Inventive Society of Scientists, and today we are going to be discussing a topic known as cholera. Cholera is an acute diarrheal disease that is caused by ingestion of contaminated food and water. This topic is beneficial not only to the community but to the professionals who are interested in the research of infectious diseases.
In infectious disease research, we have what we call the epidemiological triad. This consists of three components. The first one is the agent, the environment, and the host. A host is an organism that is being affected. In this case, it's human beings. We also have an environment. This is where an agent is. And in the case for cholera, the organism is mostly found in water or even in food.
The other component of the epidemiological triad is the agent, other than the host and the environment. The agent is what causes the disease. The agent is transferred from the environment to the gastrointestinal tract of the host. Into cholera, what is the agent?
The agent is Vibrio cholerae, which is a gram-negative bacteria.
What are the types of Vibrio cholerae?
So we have about 150 to more than 200 serogroups of Vibrio cholerae, but the two serogroups that cause infection are O1 and O139.
What are the classifications of Vibrio cholerae?
Okay, so in terms of classification, like I said, Vibrio cholerae is gram-negative. It's a gram-negative bacteria. When we look at, they are also gram-positive bacteria that have a thicker peptidoglycan around their cell walls. But Vibrio cholerae is a gram-negative, and gram-negatives have a thinner peptidoglycan and an additional layer of a lipopolysaccharide. So this lipopolysaccharide prevents water from entering the cell and bursting the cell. That is why gram-negative bacteria such as Vibrio cholerae thrive in water because they can't burst. Water can hardly enter due to the surrounding lipopolysaccharide.
So what other characteristics does Vibrio cholerae have?
Okay, so Vibrio cholerae is also a facultative anaerobe, meaning it thrives in the presence of oxygen, but even without oxygen, it can still survive. And Vibrio cholerae is also mesophilic. It survives within moderate temperatures, mostly 20 to 45 degrees with an optimum of about 30, 37. That is why it survives in the human body, because the human body has a temperature around that, within the range that Vibrio cholerae survives.
How does Vibrio cholerae cause cholera?
Okay, so how Vibrio cholerae causes cholera? When you ingest contaminated food or water, it moves through your GIT or gastrointestinal tract, and when it reaches the small intestines, it releases a toxin. So we call this toxin cholera toxin, CTX. So this toxin has two subunits, the B subunit and the A subunit. The B subunit is pentameric. It is made up of 5 strands, while the A subunit is heterodimeric. It's made up of 2 different strands. So what happens is the B subunit is the one that attaches on the plasma membrane of the intestinal cells. To be specific, it attaches on the monocyanohexocyl of the plasma membrane of the intestinal cells. When that happens, that is to cause endocytosis of the toxin. So the attachment happens so that the toxin can enter the cell, and when that happens, the A subunit is the one that is active enough to activate adenylyl cyclase. So adenylyl cyclase then increases the levels of cyclic AMP inside the cell. When the levels of cyclic AMP or cyclic adenosine monophosphate increase inside the cell, there is increase in the exocytosis of chloride ions. So chloride ions start to move out of the cell, and as chloride ions move out of the cell, for electrolyte balance, the sodium ions inside the cell leave as well, following the chloride ions. And water follows where sodium is going. So water follows through as well. And the cells start to lose more water and more water into the lumen of the intestines. And that is the water that is experienced during diarrhea of a cholera infection. That is how Vibrio cholerae causes cholera.
Alright, that's interesting. So you earlier mentioned that a lot of people die from cholera. So in which places is cholera common? Which places in Africa or across the world?
Yes, so there are some geographical places that experience cholera a lot, endemic to cholera, some of which are Southern African countries, some Asian countries, but mostly you find these areas are areas that in developing countries without a proper sanitation, yes, and shortages of water and inadequate of clean water supply.
So, what is sanitation?
So sanitation is simply proper disposal of waste. So we also have another terminology, hygiene. So hygiene are practices. So that is the difference between the two, hygiene and sanitation.
What is the treatment for cholera?
Okay, so mild cases of cholera only need rehydration as treatment. Yes. Mild cases for cholera only need rehydration, and we give that orally. So oral rehydration therapy. Unless a severe case, that's when we give, we rehydrate intravenously, and maybe when it's severe, we can even add some antibiotics like doxycycline.
So, where is this treatment done?
Okay, so this treatment is done at 3 places. So the ministry sets up 3 points during an outbreak: an oral rehydration point, a cholera treatment unit, and the cholera treatment center. So an oral rehydration point only has oral rehydration salts and oral rehydration therapy. And then oral cholera treatment center and unit have advanced medical care such as intravenous rehydration.
You mentioned earlier that a person who is infected with cholera loses a lot of water through diarrhea. What happens to the person when you are transporting the person to the clinic or to the centers that you have mentioned?
So, of course, we know that cholera kills within hours due to hypotension that is caused by too much loss of water. So it is advised that as the patient is being transported, whether from home to a health facility or from a small health facility to a larger health facility, rehydration should take place at all points, even while transporting the patient.
So, you mentioned everything about prevention, you mentioned about the treatment, but then, is there any vaccine for cholera?
Oh yes, so we have vaccines for cholera, and I'll mention 3 of them that have been approved by the World Health Organization, and that is Uvico, Shanko, and Ducoro. So to begin with, all these vaccines, the 3 vaccines I've mentioned, are all inactivated or killed vaccines. What I mean by that is, we have bacteria that is killed and then it is administered as vaccine. Sometimes we can also have live attenuated vaccines. These are vaccines that are like bacteria as it is alive, and you administer it to sensitize the body so that it produces antibodies, and the person is sensitized so that as the infection comes, the body can defend itself. But such an example of live attenuated is BCG, Bacillus calmette guillain. So this is a tuberculosis vaccine that is mainly formed by Mycobacterium bovis. So it is given, but it is contraindicated in immunocompromised children, babies, infants. Why? Because if that vaccine is given, since it's made of alive bacteria that is alive, and the immune system cannot defend itself because it is immunocompromised, then the infant might actually get tuberculosis. So live attenuated vaccines are contraindicated in immunocompromised persons. But in the case of these other vaccines that I've mentioned for cholera, that was just an example about tuberculosis. But these three I've mentioned about these three vaccines I've mentioned of cholera are all inactivated vaccines. So UVCO is made from dead bacteria O1, the cell group we spoke about earlier on, and Chanco is made of O1 and O139. So it's a bivalent. Chanco is a bivalent made of O1 and O139. UVCO is a monovalent made of O1 inactivated bacteria. So, and then we have Ducoro, which is made by inactivated O1 and B subunits. We spoke about the B subunit earlier on in our interview. So it is a combination of the recombinant B subunit of cholera toxin and O1, which is inactivated. Those are the three vaccines approved by the World Health Organization.
So how do you bury someone who was infected with cholera?
All right, that is a very good question, because mostly people do not understand when ministries put up guidelines about burial for persons that have died of cholera. So this is the reason why they do this. The reason why we put up guidelines for burial for patients who died of cholera is to prevent infection from spreading throughout the funeral and other places. So this is how we bury a person who has died of cholera. We get cotton and dip it in chlorine and cover all the openings, the mouth and the anal area, the anus, and also wrap the body in plastic to prevent leakages of fluids. Those fluids that might leak off the dead body might have Vibrio cholerae, and that Vibrio cholerae will keep spreading everywhere. So we bury dead bodies of people who died of cholera in that manner.
We have spoken over the causing, I have spoken about the pathogenesis and the bacteriology of Vibrio cholerae. My interest really is on the detection of the cholera itself. What is the significance of early detection of this Vibrio cholerae?
It is important to detect cholera early, because cholera kills within hours. Yes, so you must detect it as early as possible. And when you see symptoms like diarrhea or any symptoms of cholera, it is necessary to visit the nearest health facility as soon as possible, because it is a deadly disease, kills within hours.
Alright, so how do you collect and transport the sample?
Alright, so we have three transport media. We have the carib layer, which can store the sample for up to 7 days. So the carib layer, you use a rectal swab to collect the sample, and you can preserve it in the carib layer until it's taken to the lab. In a situation where you don't have a carib layer, we can use filter paper, because filter paper can also preserve up to more than 2 hours. You can preserve the sample until it's taken to the laboratory, even more than 2 hours later. So we have wet filter paper for culture. That's if you are using culture as your laboratory test, and we've got dry filter paper for your polymerase chain reaction.
Alright, thank you.
And then the third is a clean container, which must be taken to the lab within 2 hours. You can also use a clean container to transport the sample.
Alright, thank you.
Can cholera be eradicated?
Yes, cholera can be eradicated. In fact, that is what the World Health Organization is working on. We can work together through these preventive measures and eradicate cholera. There are diseases that have been eradicated, such as smallpox, that is caused by the variola virus. So the variola virus as of today is only present in reserves in certain countries for research purposes, but the virus is eradicated and smallpox is no longer seen as an outbreak anywhere around the world.
Cholera.
Again.
B.
Eradicated.